We've been talking a lot about look at kind of what we've done with the investment that we've made. Imagine if we had more.
Right.
Imagine what we could do.
Or imagine if less was taken away.
Yeah.
Having more is enough, but also stop
Exactly.
taking away what we do have,
There were resources
There are
there that
limiting factors.
yeah. This is not a government podcast, the official podcast for the City of Glendora. Hi, I'm Greg Morton. Our mission is to decode the processes of City Hall, one conversation at a time. In case you missed it, in our first episode, Glendora's economic development team sat down with a local business and discovered how they turned a family recipe into a local sweet spot. I think we're all pretty excited about the opportunity to do a deep dive in our topic today, so let's begin. Joining us is Erik Deurmeier, Glendora's Human Services Supervisor, who, along with Human Services Manager Debbie Lopez, leads the city's homelessness outreach efforts. That's a fair assessment of what you're bringing to the table today, right? Without
Yes.
doing a 20-minute resume.
Absolutely.
Great. Welcome.
Thank you.
Also joining us is Moises Lopez, Glendora's Assistant City Manager. Moises provides a broad look at Glendora's efforts, as well as some insight at a regional, state, and federal level. Welcome.
Thanks for the invitation, Greg.
Okay, so before we dive in, I wanted to read this bit from a newspaper article that I found. The acute shortage of dwelling houses, felt more keenly in Southern California than anywhere else in the United States, has presented a problem of the utmost concern to those interested in progress and the general welfare of the homeless, or those left to face winter with practically no shelter. That article was written November 26, 1920,
Wow.
less than a decade after Glendora incorporated. Some interesting things, too, about the article that I found. That was the Glendora Gleaner, by the way. It's Glendora's hometown newspaper at the time. They talk about, in the United States, they talk about 4 million people without housing as a consequence of the housing shortage. And then over a 12-month period, only about 70,000 homes were built, in large part because of shortages due to World War I. So I thought it was an interesting perspective of 100 years ago that they're talking about severe housing shortages. And that really kind of echoes still today. Erik, why don't you give us a brief rundown of Glendora's efforts to, because, I mean, really, the elephant in the room is Glendora has a homeless population.
We do. Yeah, it's a beautiful city, but like any city in the San Gabriel Valley or LA County or around the nation, we suffer from the same impacts, economic impacts, cost of living impacts that anywhere else does. So we have a relationship with Lakota that provides us with 2 full-time case managers. They're here in the city from 7:30 to 4:30 every day, Monday through Friday, and they provide case management services to the unsheltered people here in Glendora. They provide a proactive approach, so they drive around and they hit up their usual hotspots every morning, every afternoon, and as needed, according to community requests or requests from city staff. But they help people get their basic documents, get connected to any services or benefits available through the county or federal benefits. They help people with employment, medical resources, mental health, substance use services. So anything that's going to be an impediment or barrier to getting housing and being stable, we can help develop a plan to overcome those barriers.
And there's just really one aspect of Glendora's efforts, right? I mean, there are Lakota. What does Lakota stand for?
The Los Angeles Centers for Alcohol and Drug Abuse. They started out as a substance use treatment organization, and they've now expanded to provide direct street-level case management services, as well as operating certain interim housing programs.
And so that's a bigger organization, but the individuals that you're talking about work out of Glendora. They deal specifically, those particular individuals deal specifically with Glendora concerns, Glendora issues?
Yes, yes. They've been the same team that we've had for a few years now, which has been great as far as what contributes to good rapport building with our clientele. They are based out of the Lefetra Center on Foothill in Minnesota. They check in with our team in the morning. They end their day at the Lefetra Center, so it's a great public hub for them to work out of because they have a lot of exposure as they come and go throughout the day to the seniors and to the adults that come and visit the Lefetra Center.
And how long have they been, how long have Glendora been partnering with them?
We have started our relationship with Licata. Moises, correct me if I'm wrong, but I think it was 2022.
That's correct.
So this is the second contract period. I think they have one more contract period left. So we're still going strong. The fact that it's been a consistent team, consistent staff has really helped the rapport building because our unsheltered population here in town has been exposed to multiple outreach teams and multiple homeless services over the many years that the homeless services industry has been in place here in LA County. And it's hard to make any progress with any one individual when you keep changing hands with a caseworker year after year.
So we have Licata, we have you and Debbie as city staff. We also have representatives of the police department that also participate in outreach efforts, obviously enforcement when necessary. Moises, if you can, give us kind of an idea of, we're starting to put resources over the last several years into homelessness as an issue. What's really the foundation for that?
Sure, and I'll expand on Erik's comments just a minute ago. The Glendora Police Department has a unit called the Community Impact Team that partners with Erik, Debbie, and our LA CADA partners in going out on outreach, not just as needed, but they do that as kind of a core function of their job responsibility and focus on those quality of life type issues that affect our community as a result of homelessness and as a result of other issues in our community. And so they're actively working, and they've been a team that's been in operation now for a couple of years, and there's been continuity on that team too. So we have a really stable team that works very, very well together. And, from time to time, especially, on a weekly basis, we're able to engage additional partners like the county mental health staff that actually is here in Glendora once a week. We'd love to have them more days, but they're here once a week, and they're working very actively with our city staff and LA CADA partners in providing those services to our residents.
And you're talking about like a field clinician, right? Someone
That's
who's going to
correct.
come out and make some assessments and make some recommendations about.
Absolutely. Not just dealing, and sometimes, not just dealing with incidents as they occur, but also we know some of our clients and some of the people that we interact with need those services. And so we want to make sure that we connect them so that serves as kind of the door into that array of services that the county could provide in support of our efforts.
It's starting to feel comprehensive, right? The response is starting to feel comprehensive. There's a reason for all of that. I mean, the community has kind of told us that we need to be more comprehensive in our response. And we were getting that feedback through our community survey, right?
That's correct. So over the last couple of years, well, let me back up by saying that we conduct a community survey generally every other year, and we've been fairly consistent in the questions that we ask, particularly when it comes to quality of life type questions and assessing how residents feel about the quality of life here in Glendora. And we ask about specifically if there was one thing that we could change about what we do to make Glendora a better place to live now. Improving and addressing the condition of homelessness here in our community has been consistently amongst the top issues, not surprisingly, right? This last survey, it was the third highest quality of life concern. Just about 13% or just under 13% of respondents of that survey indicated such. The previous two surveys, it was actually the highest concern that Glendorans raised. And so because of that, our city council pays attention to this information and then formulates and challenges us as staff really to put the resources behind these particular issues.
The whole purpose of the survey, right? Is
Absolutely.
So that council can make decisions on where to spend money.
Absolutely. We start with a community survey. We work on a strategic plan that covers a 2-year cycle. That strategic plan then it formulates the basis of our 2-year budget. So you might have heard our city managers say this or our elected officials say this, but what gets funded gets done. And
Right.
so we listen to what our community's priorities are, and we try to put the resources behind it so that we can address those issues.
Okay, so before we get too far ahead of ourselves, I'm going to interpret that the homelessness in Glendora being a number one issue and now being a number third issue is maybe tied to some of our outreach efforts and people are seeing results. Is that a fair assessment? Just in general terms?
Generally, yes. Actually,
Okay.
people, our resident satisfaction with that service specifically that we provide improved over the last 2 surveys. It's still not great, we're at under 50%, but it did demonstrate kind of a statistically significant improvement. I think that is part of the reason why that is such is that we've made some progress.
Right.
There is clearly a lot of work that remains to be done in that space. But I think we're very much committed, and Erik and Debbie leading our efforts alongside our police department staff and our nonprofit partners to make a difference here in our community.
I feel like it's helped that we've been as responsive as we have been with the new homeless hotline that we have, the email that community members can use to contact city staff, which goes to our outreach team. It goes to city management, the police department. That's homelessness at cityofglendora.gov, or our homeless hotline phone number, 626-852-5200. When someone does contact city staff through those measures, we can get back to them immediately. And I think people are pleasantly surprised. The tone of an email complaint about an encampment or an individual might start off more intense and kind of aggressive. And then once they see that they're getting a response from the chief of police or from the city manager or an outreach team that's immediately going to respond to a situation, the tone comes down. And it's also a great opportunity to educate the public about what we do and the resources that we can offer and offer quickly, being able to have this local control.
We always encourage people to reach out. If you see something in our community, please say something about it. We may not know about it or may not see it. So emails about homelessness or any other quality of life concern here in Glendora, we certainly welcome all the time.
Yeah, that's a great point. How are we measuring what the population is in Glendora? How do we do that?
Sure. So the federal government has a requirement for local municipalities to do an annual point in time count. It's a homeless count where in LA County, we do it annually. I think the federal requirement is every 2 years, but we do it annually in LA County. And LASA is the organization that historically has organized that. So we partner with LASA on the local end. Our city staff at the LaFetra Center, myself included, we help to operate the actual homeless count itself and recruit volunteers and hand out materials and do the instructional videos that show the community how we go about and do the count. It's in the evening. It's usually in January. And so those reports are sent, that data is sent back to LASA that then with the USC Masters of Social Work program, they analyze the data and then they get the results back to us usually around summer. So we're still expecting the results from 2026. In addition to that, though, the city has seen that the details from this reporting is not what we would require on the local level to truly understand and provide and develop programs to address homelessness. So the city's invested out of its own money into their own homeless census through CityNet. And so the most recent one we did was in fall of 2025, where we don't just do a visual count like the LASA point in time count does, but we actually engage one-on-one with the individuals. And so that's our outreach team, our street outreach team, myself, our police department with CityNet staff, that we go around and have a survey of 30-something questions. We ask detailed questions about individuals to really understand how they became homeless, what their struggles are, their source of income, where they're from, what their health concerns are, if they have worked with case management in the past, if they're interested in connecting with services or housing, to really understand like how we can best develop programs to respond to our specific population.
It's important to note or underscore the difference between the methodologies there. And it's not just a difference in numbers. The point in time count as it's conducted here in LA County is observational. So folks are assigned a census tract here in town. They get in their cars, they drive around. If they run into somebody that appears to be homeless, then they mark it down and the location of where they observe that individual. Same thing with vehicles or RVs. If they look or appear as if it's a temporary home for a person experiencing homelessness, that gets put into the GIS-based system that people use. All of that data gets extrapolated out. So even though there are people here driving around looking and making observations, it's actually not a statistically significant number that's generally produced by the report.
It's also very subjective, right?
Mhm.
Completely. And so, and LASA has acknowledged that when they produce these numbers, they're not statistically significant at the city level,
Right.
which is a challenge for us for the reasons that Erik described. So the only statistically significant number that they produce is at the regional level. So for us, it'd be at the San Gabriel Valley level, right? It doesn't really help us. And so one of the reasons that we do our own census is we want to ask and engage those people who are experiencing homelessness in our community, ask them questions. And we've been asking them the same questions for the last couple of years so that we have a better understanding of who they are, what their needs are, and how we can best address those issues. So it's not just about healthcare or having driver's licenses. It's also about talking about substance abuse or behavioral health challenges, mental health challenges, and making sure that we're providing access points to those services to address those issues. We also have individuals who are, have some challenges with the police department or have criminal justice issues. And so we want to address those as quickly as we possibly can.
And really, a head count's not going to give you that data.
Absolutely not.
Right.
The more demographic data that we can collect, the better positioned we're going to be able to not just address the issues, but provide the resources to address those issues.
Yeah. And if we're going into areas that we're more familiar with, Lakota goes to every day, maybe Erik, you may travel to on a frequent basis, we're less likely to encounter a zone where, because at night in January, you may drive through a zone where you're not going to encounter anybody. And that just is how it happens. That's how the chips fall. So a more focused Glendora count would be a little bit more specific and significant at the local level. Give me an example of how the Glendora count has really kind of opened our eyes to our population.
Right. So we've had 3 to date, 2021, 2023, and 2025. The numbers, in case anyone's interested, the first count in 2021 found 113 individuals that were surveyed through the CityNet. That's the individualized Glendora-specific count. 2023, that number dropped to 106 individuals. And this past fall in 2025, it was 64 individuals. So some of the things that we ask is, what is your actual living situation? Are you unsheltered outdoors or are you in a vehicle, for example? We ask where you were living when you first experienced homelessness, whether it's in Glendora or a neighboring city or outside the county or even outside the state. We ask how long you've been experiencing homelessness, if it's within a certain number of months or chronically homeless more than a year. We ask what your source of income is, any health issues. Do you consider yourself to have mental health struggles or struggles with substance abuse? We ask what type of ties to the community, even if you weren't experiencing homelessness initially in Glendora, what brings you to this community? And we can study that to see that a lot of people do have ties. The majority of our population are either from Glendora itself, went to school here, have children that still live here, or family that still lives here. And that's going to give us a lot of guidance as to what type of resources and what type of approach to give those clients. I mean, Glendora is a great town. We all know that. But when you're experiencing homelessness, and you grew up in this town, you don't want to leave to go to LA. You don't want to go to Skid Row, where you don't have your local doctor, where your mom doesn't live down the street, where your friends aren't nearby, where your case management, your resources, the library, the Lopez Center, you're suddenly disconnected from all those people and thrown into an environment where, San Gabriel Valley, especially Glendora, is very different from downtown LA. If you didn't grow up in that area, you're going to have certain struggles that you're just not accustomed to, on top of just the inherent trauma of experiencing homelessness. So we get some resistance when we try to offer resources to individuals that are not from Glendora. So we need to develop resources that are specifically in mind with our population. And so we've tried to do that by bringing mobile medical services out to our community, trying to partner with organizations like the Department of Mental Health, with workforce development programs through the county, through substance use services, through our outreach partners, Lakota, legal aid services. So this CityNet survey really helps us to understand specifically what our individuals' needs are.
To say all of those service offerings are critically important for those individuals. But more importantly, if you look at it at kind of the more macro level, they're touch points that we create, right? The more we interact with some of these individuals, the more of a relationship we're able to build, the better confidence there is in each other, we're building trust ultimately, right? It takes a lot of time. I think that's one of the things that gets lost in this conversation is just the amount of time and effort that our staff and team puts into connecting with the individuals where they are, building that rapport, building the trust. So ultimately, we can get to a place where they either accept services or understand that where they're residing isn't acceptable, and we're going to do something about it.
Being out on the street or being unsheltered isn't good for anybody.
No,
I mean,
no.
However you look at it. Erik said something that made me think of in doing some research on how language matters. I ran across something talking about terms of we use terms as houseless or unhoused or unsheltered, and I found this research study that said lived experiences in the literature strongly illustrate that simply having the physical protection of housing does not necessarily define home. And I think that speaks to people who are from this area or have strong ties to this area, not wanting to travel far out for services, because when you say that they're homeless, Glendora for them is home. They just don't have shelter. They don't have, so that's one of the, I mean, what we're talking about is an incredibly complex problem, right? That didn't spring up overnight and isn't going to be solved overnight. And so it's just one of the many issues of building that rapport with someone and getting them to trust that have their best interest in mind. Is that fair?
Right. And the fact that we understand that instability is instability, that helps us to just make that first step in connecting with our clients. Because if you are couch surfing from family member to family member, and eventually those ties get strained and you now have to reach out to friends and you're couch surfing from house to house, and those ties get strained, and then you borrow someone's car and you're living in their car. This entire time, you might have had a shelter over your head, but you've been homeless. And that means that you're coming with the trauma and the stress and the instability of homelessness. You have a survival mindset. You're focused on today. How do I take care of where I'm going to sleep safely today? How do I meet my food needs, my healthcare needs today? You're not necessarily thinking, I need to send out 30 applications this week and try to get a good job, or I need to apply for Social Security, when there's someone knocking on my car window at night and I'm not feeling safe. So I need to think, okay, tomorrow I need to park in a new location.
Right.
So when we're approaching our clients, we really need to understand what they're going through and not just make assumptions about what we feel like they should need. We have to let our clients lead, and that starts by understanding their story, by pausing to listen to their story. So when we make first connections with people, all we do is introduce ourselves as who we are. We let them know this is kind of an overview of the menu of services we can offer. Now you tell me something about yourself if you're comfortable doing so. And a lot of our first few interactions are just hearing their story, just getting to know them. And if someone's not necessarily comfortable telling a complete stranger with a badge who walks up to you,
Right.
Their life story, then we have to make them comfortable. And sometimes that means buying them some coffee,
Yeah.
or getting them a new pair of shoes, or taking them to breakfast. Because if that's the investment, the $20 or $30 of getting them a pair of shoes and a meal or something, but if that leads to housing, if that leads to them seeing a doctor for the first time in 20 years, I would say that's a good investment. Nothing else works. No other approach works. I think any other professional in the field would tell you that you have to start with the relationship.
The ultimate goal is obviously to get people off the street or off other places where they're not supposed to be residing, right? Be it, the South Hills or an off ramp off the 210 or 57, kind of those areas. One is it's not good for them. It's not good for anybody. It's not good for the community. It creates a visual impact. It creates a very real impact in terms of trash, debris, and other unsanitary conditions. And so we work with people that are willing to work with us and are patient with those individuals. But at the same time, and not to seem overly aggressive here, but we also have an obligation to maintain order in our community and address the real and perceived public safety impacts related to homelessness. And so we do address encampments. We always lead with services, but also make it very clear that, some of these places are not meant for them to be in and that they need to get out. And we provide them access to the resources so that they can get kind of on the path that they need to be on. But we also go out there with, particularly with Caltrans or the Highway Patrol and another nonprofit partner that we haven't talked too much about, which is, not a nonprofit partner, but Ocean Blue, that does a lot of the trash cleanup and removal and environmental remediation related to all of these encampments. Most of which you see kind of in the southeastern part of town or in the South Hills when they've popped up. But it's critically important for us from a community-wide perspective that we address these issues as quickly as possible.
Yeah, and you added another layer of complexity to the conversation because you started talking about Caltrans and some areas that technically fall within the boundaries of Glendora, but we don't have jurisdiction over. And so there's relationships not just with the unhoused community that we need to cultivate and foster and build trust with, but we also have other business partners and agency partners that we have to build relationships with and work closely with in order to address those issues, correct?
That's correct. And they have their own set of rules, right? So the way we go about conducting our engagements and encampment remediation is different than the way that Caltrans and CHP have to operate. And so we try our best to work with them, and they've been very good partners for us. I wish they were here every single day, and I think all of us would like that, but they're also very stretched, and we know that they have limited resources. And so we try to get them out here to address a lot of this stuff as quickly as possible, and they know it. We've had opportunities to talk with their staff members and their leadership here for the district within which Glendora is in. But it's a challenge, and it's going to be an ongoing challenge for us. It's something that, if you ask Erik and Debbie and LA Cada, they're probably out kind of in two general areas most of the time because that's where we know the greatest impact is. One being kind of the southeastern corner of our community, and then Glendora and Grand, which is another area where we've had kind of historically some challenges there.
Before we dive too deep into challenges, because I know Erik is going to provide some great insight into the kind of the day-to-day challenges. Let's just kind of finish the part of the conversation talking about population itself. A lot of people in the homeless population here in Glendora have Glendora ties, but we also see a lot of new faces. And I think a common misperception or a common myth is that new faces mean that the population's growing. And so, Erik, what can you kind of say about what new faces mean for the homeless population in Glendora?
I want to start probably with the facts from the city account and just let the data speak for itself. And then even the LAHSA point in time count, that's again with a big asterisk, is not significant on the local level, but you look at the trends of that, you see that homelessness is not increasing in Glendora. If anything, it's either staying stable, depending on what you're looking at, or it's declining slightly. And that's because of our proactive approach. But what we're seeing when you see new faces is there are factors that, the elephant in the room is the A-line opened this past fall here in Glendora. But prior to the A-line, it stopped in Azusa, right by Citrus College.
Right on the border.
So when that train stopped at, in the middle of the night, individuals would have to get off the train and they would stay around the train station or the parking structure. Some of them would be calling emergency services because it was too cold or they just needed a place to go. They would end up at the closest hospital, which is Foothill Press. After they were discharged from the emergency room, now they're in Glendora. So the next day after getting off the train, they're in Glendora. Since the A-line has opened, I'll just speak from what I've heard, and anecdotally also, I think the police department would probably verify this as well. We've seen less of that activity around Foothill Press and Grand and Route 66. And it seems that they're now riding to the end of the line in Pomona. They're just continuing on. So people do get off and they walk around town and they might engage with our outreach team. And we do make appointments with these individuals, whether for shelter or services. Most of these people we don't see again. It's just one-off situations. So we have seen more new faces, but they're usually gone within 24, 48 hours. And with that said, I do want to clarify that the Glendora Police Department and our Lakota outreach team has made the A-line station a particular focus, just making sure that we're always present. If there is any change at all, we're the first to respond. But the metro system has their own law enforcement presence. They have their own outreach presence too, in addition to what our team provides. So Union Station Homeless Services, for example, is the outreach presence that rides the A-line all the way to the end of the line and back here in the San Gabriel Valley, providing services. So if someone's on the train, they'll get connected that way. If they get off the train and step into Glendora, our Licata team will be there. So we do see new faces, but it's not an uptick. These are not people that are sticking around town for the most part.
And the A line is not the only access point to the city, right? I mean,
Yeah.
people could just walk in,
There are no walls around
right?
Glendora, last I checked.
And
But
Right.
it is, look, and I think let's be real about it, right? What we see on television, particularly some of our larger neighbors to the west of us, have significant populations, and transit is a very easy way for that population to migrate. That's a very real possibility for us, and that's something that we're not naive about either, right? Erik mentioned, our outreach teams and our police department check in at the A-line station several times a day at different times of the day because we know that that is a major community concern. We also are, we know that it is a concern for us as well, right? I don't want to be naive about it. That is something that we're legitimately concerned about, not just now, but moving into the future. I think that's an ongoing conversation that we're having with our metro partners. There is a tap to enter and a tap to exit system. That tap to exit component hasn't been turned on along this latest extension, and we're working actively, not just Glendora by itself, but with Laverne, with San Dimas, with Pomona, to make sure that that system is in place so that we mitigate those experiences to the extent that we possibly can.
And we have a council member that serves on the construction authority, right? So
That's correct.
So we have like really strong relationships with both the construction authority who builds the trains, but also Metro itself, outside of staff making phone calls and those relationships.
Yeah, and the council member you're referring to is Councilmember Thompson, who's been part of the Gold Line Construction Authority for an extended period of time. But I also have to highlight the work of all of our elected officials. All 5 of them have engaged with their partners at their respective agencies to make sure that we've got, so that folks know what Glendora's position is. And so they regularly advocate, be it at Metro, be it at, the county board of supervisors level, be it at the COG level, to make sure that we're expressing the concerns and kind of sharing our experiences, but also advocating on behalf of our community when it comes to funding opportunities and making sure that it's available for Glendora.
Yeah, great point. So not just staff kind of rolling up their sleeves and doing a lot of this work, but council is also at the legislative or high level,
Absolutely.
really kind of.
For staff to complain is one thing, but when electeds talk to other electeds, I think it's far more meaningful. And so our electeds are informed. They're advocating for our community regularly.
We talked about Ocean Blue. We've talked about the CIT team. We've talked about Licata. All of these resources, obviously, they cost money, right? And is it fair to say that Glendora has made a substantial investment? We continue to do so, that financially addressing homelessness is a challenge in terms of resources.
Absolutely. Absolutely. I mean, the array of programs and services that we provide, the staff time required, the contractors that we bring on, our nonprofit partners or business partners to kind of help us in this effort, all of that takes money. It costs us money. So we're spending about $2 million a year to address homelessness here in our community. Part of those efforts and part of, in addition to everything else Erik does, we also pursue grant funding opportunities to help support and augment or supplement some of the local funding that we use. I think folks are fairly familiar with Measure A, which is a half-cent sales tax measure that was approved by the voters here in LA County. We get a direct allocation of funding through that process. We estimate that the Glendora community generates about $6 million annually for Measure A, the big county pool. Unfortunately, we only receive about $190,000 in direct funding. That's not acceptable to us by any stretch of the imagination, and it's not an acceptable rate of return, frankly. And so that's an ongoing issue that we have with the county, having access not just to direct funding, but also to the services that they provide so that they can help alleviate some of the challenges that we're experiencing here locally. Again, credit to our elected officials who this is an issue that's very near and dear to many of them, who have been very vocal and active in highlighting that disparity in getting those resources back. On the backside of that, receiving that grant funding opportunity, it takes an incredible amount of administrative work to manage that money. There's an incredible amount of reporting that has to be done. There's an incredible amount of paperwork, tracking statistics and figures to relay that information back for good purposes and good reasons. I think we want to be very transparent about how much money we're using, where we're using that money, and ultimately what results we're seeing. But even the administrative side of accepting $190,000 is fairly extensive. It takes a lot of staff time to put that information together. That staff time, those are resources that could be otherwise used to address the issue more directly.
Where does the local money come from? If we're spending our own money, where does that come from?
That comes from Glendorans. Sales tax being generated here, all of the resources, measures E and Z help fund that. In fact, measures E and Z help fund the community impact team.
Erik, you're in the day-to-day operations for us, and you're making trips to LA County, and you're on the phone with LA County. And talk to us a little bit about some of the challenges that you experience with kind of the lack of resources, or even the resources that are there, but still the challenges associated with those.
Right. So most of what we try to do is just connect people to services that everyone in the community, housed or not, has to access. So the DMV, for example, you can't really access any benefits or healthcare or employment or housing without an ID. So we have to start there. If we can't use our local West Covina DMV because it takes 3 to 4 hours, we all know that, preaching to the choir. We have to drive out of the area, out of the San Gabriel Valley, just to have a faster DMV so that we can make it back in time to do more work with other clients in the day. We can't set aside an entire half a day or an entire day for one individual for one service. So our team's constantly making these decisions about how to best use time management just because certain public services are so impacted, whether it's funding cuts at the DMV or funding cuts at the DPSS office. I won't speak to that. I don't know about that. But a trip to the DPSS office can easily be a few hours. A trip to the DMV, the same. And that's not counting any time that we're trying to access medical services. There have been days when some of our clients, we come across them and they have a medical emergency. And so we transport them to the hospital and we sit in the ER long after we should be clocking off from our jobs, and we kind of have to tag team a little bit. Accessing emergency services is a huge barrier for an individual. If our job is to try to connect them to housing, but they have an abscess or some kind of open wound or some major heart condition, and they're not in the state of mind to talk about housing or talk about shelter or accept shelter, but they're sure as heck going to end up on the street if we leave them there. So we have no choice but to take them to access the services that they need. Same is true for the DMV, like I said. So just the wait time is a huge barrier. But
you told us a story. We were kind of prepping, doing some pre-production meetings for this, and you were telling me stories about spending half a day getting paperwork filled out and submitted, and all that really gets you is another appointment.
Right.
And so the process itself can sometimes be
Mhm.
a challenge, that there's so many steps, and what everyone is going to just say is obviously red tape or bureaucracy. And you, part of a city agency, also experiences that.
Absolutely. Yeah. We are a small team, so there's only a handful of us that are doing this work, but we constantly have to butt our heads up against this massive bureaucratic system that we encounter. So we have to try to find creative ways of meeting a need. At the end of the day, if we have a certain goal of getting someone an ID, getting someone Social Security benefits, maybe there's another way. And so we always have to try to find, is there a personal relationship with someone with the DMV or at the DPSS office that might be willing to come to an outreach event that we can host and kind of bring the services to people? And if you ask around enough, and if you've been in this field long enough, you know that occasionally these services are available. So something that should be publicly available to everyone is only accessible to our clients because we have a personal relationship with an individual at another agency. And that just seems inherently, fundamentally problematic.
Yeah.
That the only way we can give these life-saving services to people is because I happen to know a guy, right? So we have started doing that. I mean,
but that's correct me if I'm wrong, and just speaking from a community member perspective, is that really is a great example of why we should continue to invest in the issue, because if we want this population to get themselves off the street, we need experts to be able to navigate the system, because there's no way someone who is unsheltered is going to be able to navigate it themselves.
not consistently and not over a long period of time, not without getting dejected and discouraged. And eventually it becomes something where you put so much of your energy towards trying to navigate this bureaucracy you're neglecting to meet your food needs for the night, or your dog's needs, or to go to medical care, or something even more important, more pressing.
I think, we're investing in these programs and staff in particular because it's important for our community, right? Homelessness is a major quality of life concern for our residents. And so we have that obligation to be responsive. But if we don't make that investment, I think the challenges that we would face here locally would be compounded by a variety of other things and make the situation potentially worse, right? A great deal of what Erik and the team does is eliminate barriers and try to eliminate excuses, right? Eliminate barriers at the bureaucratic level, but also excuses that we hear from some of our clients and why it is that they don't go a particular vacation or can't make we're holding people accountable to the commitment they make to try to solve these particular issues.
Right. So bringing services to them is a great example of eliminating the bureaucratic hurdle, but also the kind of personal hurdle, like, oh, I can't make it out there today. No problem. We'll bring the services to you.
Right.
So we've done 3 of these resource events here in the community where we've started partnering with a mobile medical team that literally provides medical services through their mobile clinic in the field to individuals. So accessing medical care there's no longer an excuse not to do that. We've had the DPSS office, the Department of Public Social Services, come out and help people sign up for CalFresh and general relief and any benefits like that might have been cut. We're partnering with the homeless court legal services to help expunge and reduce some citations and possibly misdemeanors. So things like that, we're trying to
Explain too why it's important to address those issues, right? Because ultimately it becomes a barrier to something else in the process. If you've got a criminal record,
right.
Generally minor stuff, it still can be an impediment to get stable housing. It can be an impediment to get a job. It can be an impediment to access other services.
Right. There's some housing resources or even just apartments or room rentals where the owner of the home might want to do a background check. And when they see the misdemeanor or they see the number of credit issues that you have, now they're looking at someone else. When in this market, everyone's looking for housing. There are a lot of people willing to pay cash immediately. They don't have time for us to come back to them in 6 to 8 weeks once we've kind of resolved this major hurdle and then give our client a second chance. So we have to prepare all this before we even get to the point of someone's doorstep and saying, are you willing to rent to our client? But with that said, going back to the funding, one of the benefits of the funding that we have now is we have a line item from the Measure A sales tax where we could provide a landlord incentive, another creative way to kind of overcome some of these barriers. If a landlord's maybe hesitant about working with someone with a homeless history, we could provide a one-time incentive. So there are little creative things like that we can use to try to overcome these barriers. But I think the big picture is that if we had more resources, we would be able to do even more. If we weren't spending more time on paperwork and the bureaucratic issues and waiting in a waiting room, we'd be able to spend more time investing in community partnerships with churches, with nonprofits, with county agencies. We'd be able to spend more one-on-one time with clients and with families that might be at risk of homelessness. I don't know if you want to talk about the rising rate of senior homelessness or seniors living on a fixed income, but that's definitely something that's on our radar that we need to try to cut off the flow of individuals coming into homelessness. And that's the best way that we can kind of envision, trying to prevent that.
And so we're talking about scope. And I saw the statistic from the Stanford Institute Economic Policy Research group, and they said they're estimating almost 76,000 shelter beds in the state of California between emergency shelters, transitional housing, and a program called Safe Haven. And so that's 75,938 was an estimate. And this is a 2024 estimate. And that same year, the estimate for California's, the state's homeless population was 187,084. So even if those shelter beds were filled 100% to capacity, which never happens, you're still talking about over 100,000 people without shelter beds. But talk to us about, on a day-to-day basis, why it's important to still go after those, what I'm going to call small wins.
Because it keeps you showing up every day. Like you have no motivation to keep doing the work if you don't see any impact. So even if you can't get someone permanent housing, you set your bar a little lower and say, well, at least I got them shelter. And if you can't access shelter, well, at least I got them the ID that they haven't had for a year and a half, and they finally agreed to go with me to the DMV. Or maybe that's not possible. but they've had this heart condition, and they've been barely hanging on there, and it's a surprise that they keep waking up every morning. You finally got them in to go see a doctor. Those are the major wins on the personal level that kind of keep the team motivated and encouraged to keep fighting the big fight on the macro level when we're advocating for more funds to do more just locally in Glendora. We need to also encourage our city partners and other counties to do the same on the state and federal level to access more funds, because homelessness is a regional issue, it's a national issue, and it affects everyone everywhere. So when we don't see that support, it is daunting. It's discouraging.
It's about making progress. I know it may not necessarily be visible to the broader community, especially when you drive by and see a person that appears to be homeless or is homeless. Those small wins that Erik mentioned are important to continue making progress. And it's hard to see it because it's so dang slow. It takes a lot of time and effort and sacrifice and frustrations and anger. But it's important that we keep going, because that's the only way we're going to be able to address it in a meaningful way. And I don't even use the word solution, because I'm not sure that we're ever going to solve this problem.
Right.
But I do think that we need to be committed to making progress so that all of our community benefits, including the people that are kind of in the midst of that challenge.
Yeah, I mean, it's been over 100 years since that article, right? And we're still talking about these ridiculous housing shortages, and not just in because this isn't just a Glendora problem. This is a regional problem. This is obviously California concerns, and obviously across the United States. So,
I mean, it's a regional issue, and we do have a history of it. Like you said, 100 years ago, we were hearing about it in the paper, but exponentially. I just want to make it clear that it's grown significantly over the last 50, 60 years because of policy choices that are being made at the local level, state and federal level. And those are things that we have to try to address and advocate for, while we're also working on the individual, like the outreach teams working on the individual and their specific goals. But we're also partnering with this massive coalition of like-minded providers and municipalities and governments to try to advocate for broader change, so that this isn't something that we continue to just throw money at and see no results. The investment is worth it if we see results, and if we continue to cut resources that provide permanent housing, provide interim housing, provide necessary medical and mental health services, we won't see the results that we're investing in right now.
And we're still seeing, we haven't talked too much about it, but substance abuse issues are very real. It's a very big impediment for us. The access to those services, those specialized services, is limited. We just don't have a lot of those types of facilities or services available to put people in. We do the very best that we can. Same thing for mental health and behavioral health. I know the state has made an effort, but the magnitude of the challenge is such that I've heard the analogy that we're trying to fly the plane as we're building it,
Mm-hmm.
right? And at one point in time, we had some of these resources, but the longer we wait without those resources, the bigger the challenge of actually implementing and more expensive it ultimately becomes to be able to provide those services and make the type of progress that we want to see. So we're kind of in this very turbulent period where we need to respond. We need to provide these services. We need to address encampments and remove them. But we also need the continued support of our county partners and our state partners and our federal partners to keep up their end of the bargain. Cities are not typically providers of public social services. That hasn't been our role traditionally. It's been a function of the state and the function of the county. The challenge is so large that we've had to jump in and augment the resources and services being provided. And so we're basically competing for a very small pool of talented people that provide these services, with a limited number of beds or facilities that are actually available to us to be able to address some of these issues. And so it's a very complex system that we're navigating every single day.
We've been talking a lot about look at kind of what we've done with the investment that we've made. Imagine if we had more.
Right.
Imagine what we could do,
or imagine if less was taken away.
Yeah,
having more is enough, but also stop taking away what we do have.
There were resources
There are
there
limiting factors.
Let's be clear that we're not working with just a shortage of new resources. We're also working with things being taken.
Being pulled.
So,
yeah.
I mean, most of our clients are Medi-Cal recipients. They receive Medi-Cal. So when the policy is passed where it gives new hurdles for them to even keep their Medi-Cal, that work will fall on our outreach team to make sure that they don't lose their Medi-Cal. So instead of working more hours to get them into housing, we're working more hours just to keep them from losing their health insurance or to keep them from losing $200 or $300 a month in CalFresh food aid. So that's something that was taken from us and gives more. It takes more energy. It takes more resources for us that we're investing in. The city is paying for this outreach team now to keep health insurance for homeless clients instead of getting homes for homeless clients. So that's something that we have to consider too as a X factor.
What Erik said is important for us, right? It's not, it's not certainly not our place to make a decision or determine what's right or wrong when it comes to policy choices. But at the end of the day, the consequences of those policy choices are the ones that we have to pick up and be able to address, because that's what our community expects of us. That's what we're here to do to the best of our abilities. But we can't ignore those very real consequences of some policy decisions that we get from Sacramento in particular, which is we can have a whole podcast on that alone. But again, our commitment to addressing these issues to the best of our abilities is unwavering, right? Not just because our community demands it of us, or our elected officials demand it of us, but I think in hearing Erik talk about it and seeing them work, it's important work. They're making progress. It's frustrating at many points in the process, but it's incredibly important that we stay true to that effort so that we don't lose any of the progress that we make, more importantly.
Right.
Because I think that's a very easy thing to do.
I'm going to start with you, Moises, and then I'm going to go to Erik. Kind of give us a final thought about, next steps or kind of maybe the next several years in what our approach will be.
Sure. I think that's actually a great question and a great way to kind of end this portion of the conversation, right? I think Glendorans should know that we're committed to address this issue. We recognize it's a community concern. We don't need the community survey to know that. We know it, we see it, we certainly hear about it. So we're committed to doing the right thing. And the approach that we're undertaking here is balanced. One, we want to provide connections and services in support of those people experiencing homelessness so that we provide them a meaningful path out of homelessness. But by equal measure, we recognize that homelessness creates community quality of life concerns, and we're equally committed to addressing those as quickly as we possibly can in a very safe and responsible and legal manner, because we have rules we also have to follow. And so I think we're very much committed to address this issue here locally. We will continue to do it. It's not something that I think it's going to be something that we're going to be challenged with for the next several years, if not decades. And so we need to keep going and commit to that level of stability from a staff perspective, and financial support to the extent that we can continue providing it.
That's great. Erik, you're our content expert. You're out there in the field. You're communicating with this population. We had this conversation today. At really the most critical level, is there anything we missed that you really want to make sure that you leave us with?
I think just ending with something light. Any problem as big as this is still surmountable. We could still find a solution or work towards a solution, especially on the community level, on the local level. Like, this isn't something that a team of 3 or 4 or 5 can or should approach. This is something that the community as a whole should approach. And by community, I don't even just mean Glendora. I mean our county, our state, our nation. We should look at collective means of participating and creative means of participating, just like how we've had to do as the case management side. If there's a bureaucratic hurdle, you find a creative way around it. You build a relationship with people. You build a relationship with your clients. And sometimes we can overcome these hurdles to housing by building a relationship with community members. And that's my goal, is to try to build these relationships with faith communities, with nonprofits locally. Shepherd's Pantry, for example, we have some great faith communities that have helped us with hygiene services and food donations, gift cards. This is a community I want to shout out to. Like, you guys have asked for this through the community survey. You guys have invested in this. This is your money. You're paying my salary. All of us here at the table. I just want the community to know that this work is making an impact. It can make even more of an impact, not to pull even more from the community, but to kind of inspire people. If we continue to work together, we can overcome something like this that even is bigger than our our city or our local community. If this is something that, federal resources and state resources are failing us on, this is something we can still improve our local community. And that's something that even the CityNet staff mentioned when they presented the CityNet survey results in 2025 to the City Council. They mentioned that Glendora specifically has had less of an impact of homelessness increasing because of the proactive services that we've had through the police department and LACADA and human services and just collectively as a community. So we can overcome this if we work together and we don't just push it off to one individual or one group, and we realize this is our community. The individuals experiencing homelessness are our community. We can work with them, we can work for them, but we can work together with the service providers to provide that human touch that Glendora is so great at providing.
Very well said. And this is the reason why Erik's our guy.
Absolutely. Absolutely.
Okay, before we end, I do want to give a shout out to Moises and Erik. Thank you very much for being
Thank you.
a part of this today. And for the community, Erik gives regular updates to City Council, like 4 times a year, maybe once a quarter?
Yes.
Sound about right? You can access all that information on the city's website, cityofglendora.gov. The other thing is we have the outreach website, that's cityofglendora.gov/outreach. Oh, the last thing I wanted to mention is that Erik and his team, Debbie Lopez, who's the human services manager, provide articles on a regular basis for the Glendora Report, which hits every mailbox in the city 3 times a year. We have a winter spring issue, a summer issue, and a fall issue. So if you want more information on what's happening with the homelessness outreach in the city of Glendora, just look for your mailbox. Thank you very much, gentlemen, and I really appreciate the conversation.
Thank you.
Thank you.